In today's episode, we deep dive into understanding what Vata dosha is, but through the lens of modern medical science. In Ayurveda, Vata is associated with movement, lightness, and the nervous system, and often expresses the imbalances through issues like anxiety, insomnia, irregular digestion, or joint pain. But can we detect Vata imbalances objectively through blood work and medical testing? In today's episode, we will explore how certain biomarkers can show up in measurable clinical ways that indicate a Vata imbalance. Hope you enjoy this episode. In today's episode, let's understand about the biomarkers of imbalanced Vata. Now, compared to pitta and kapha, which are quite tangible in nature, it's quite easy to detect imbalances of pitta and kapha. You can do a lot with investigations like blood tests and also body fat percentage, inflammatory markers. However, when it comes to Vata, the thing with Vata is it is intangible. Like in Ayurvedic textbooks, it's written, when kapha and pitta are murtatva in nature, murtatva means that which has a physical form. But Vata is amurtatva. It does not have a physical form. It's intangible in nature. It's like trying to assess the output of a blue-collar job person and a white-collar job person. Blue-collar job, it's quite easy. You just need to understand in this many hours, this much is the output. You can easily assess it. But when it comes to a white-collar job, you have to really look at what is the end result that job is bringing. But you cannot just put, okay, this many hours that person worked, is the output come? No, you cannot assess that. And that is the nature of Vata. It's very intangible in nature. Now, if you look at the root etymology of the word Vata, Va, Gati, Gandhayo, it means that which contributes to all kinds of movement. When you say movement, it doesn't mean that you're just walking. It's also all kinds of information is moving. Like today we have Bluetooth, Wi-Fi, and you can transfer files through AirDrop. This is where Vata comes in. Now the Wi-Fi signals that are coming, this vibrations, this is where Vata is. And if you look at the elements that are dominant with Vata, it is the space and the air. Now space, you see, it's huge. It's very difficult to quantify space. The whole of universe is a space. And then air also, to a great extent, compared to earth and water, air is also a challenging thing to quantify it. Now that's the nature of Vata. It's like, let's say you have to fight with the enemy. And imagine you manage to get the best weapon, but what if the enemy is invisible? And that is what Vata is. And that is why treating diseases of Vata is one of the most challenging, because it's very difficult to identify why this is happening. However, with new age technology coming with a lot of understanding, even though unlike kapha, you can identify, okay, let's just check the high cholesterol levels. That means high kapha is there. If high CRP or liver function test is showing high markers, that means pitta is high. But when it comes to Vata, it's always deficiencies in your blood. When you look at other things, it is always high above the borderline. But when it comes to Vata, it's mostly deficiencies. Because when your body is depleted, that's when your Vata goes up. So sometimes they say, Can it be possible that the kapha is high and the Vata is high at the same time? Absolutely. You have the term overfed and undernourished. Overfed is a clear symptom of high kapha. You can overeat and you can put on belly fat and your cholesterol levels can be high. And you can still have a lot of deficiencies of vitamins, some trace elements, and that leads to high Vata. Now let's understand what can be the symptoms of high Vata if you do a blood test. Your vitamin levels can be deficient, like vitamin D3 is deficient, vitamin B12. We know that if vitamin B12 is low, tendencies of anxiety and overthinking and also irritability in the mind can happen. This is a clear example. And another way to look at it is the cortisol levels can be high or the stress hormones can be very high. And one way you can identify if the cortisol levels are high, you can do a blood test. At the same time, a saliva or a urine test, depending on the quality of the investigation center, you can do various tests to assess how is your cortisol levels. And another way with the new age, with the use of smartwatches or the smart rings that people wear, there are various methods to identify the VO2 max and your heart rate variability. Now, I always say the good Vata is what we call Prana. And the imbalanced Vata is what we call Vata. Now, the good Vata is called Prana Vayu, and that is what we call as the VO2 max, the ability of the oxygen for the body to absorb and utilize it. So, if you see people who are fitness enthusiasts, their VO2 max can be on a higher side. But there is a issue. It doesn't make sense only if you have high VO2 max. You also need to have a balanced heart rate variability. Because I've seen so many patients who come and they have their identity that I am a fitness enthusiast, but they need not be healthy if your heart rate variability is low. So there was a patient who came with burnout, and she loves to do fitness. Like fitness means she goes for marathon running and CrossFit. And her issue, borderline burnout and inability to have a deep sleep. So naturally, I just asked her if she's using a smartwatch or something, and yes. And then I was just assessing her all the data that was given in that app. Her VO2 max is like a pro athlete, and her HRV is quite weak. So it's like when your HRV in Ayurvedic terms, you can call it as the Vyana Vata. It is your ability of the heart rate. When your resting heart rate is quite good, which is quite low, that means your HRV is also good and your ability to relax and let go is very high. So it's like you have the ability to speed up, but you don't have the ability to rest and relax. So you need both of this. It's like there's no point in just having strength. You also need mobility. It's like in the Vedic concepts, we have the Shiva and Shakti. You need power and you need flexibility. Only when you have these two, it makes sense. It's like you have a car, you can go on full speed, but you can never brake. That's what happens when you have high VO2 max, but your heart rate variability is not balanced. So you need to check your VO2 max is a great way to assess how good is your Prana Vata. And you also need good HRV, heart rate variability, and resting heart rate when this is balanced. In order to sum up, you can understand by deficiencies of vitamins or trace elements. Sometimes, when people take magnesium, they say they are able to sleep well, or there are patients who say when they take magnesium supplements, their restless neck or restless leg, it calms down. They don't have that restless leg. But there are multiple other factors associated with that, but don't take it to the face value, and please consult with a physician if you have any of these conditions. However, taking magnesium, it grounds the person. And same way in a woman, if the iron levels are very low, because you see, iron is something that helps to ground. When the iron levels are very low, the Vata can go up. And the symptoms of fatigue, irritability, and low energy, low immunity, all these can happen with low levels of hemoglobin. So all of this put together, it's unlike kapha and pitta where you can do a multiple blood test to assess it. Vata, you understand it by seeing the deficiencies. Whereas pitta and kapha, you see it by seeing it is excess in the body. So when your vitamin D is low, B12 is low, or magnesium contents is low, or if your hormone levels like the cortisol or the stress hormones are very high, and the other ways. And another thing that I also check, people when the Vata is high, they complain, I am having too much of bloating or irritability in my bowel, or I'm not able to poop well. There are patients who say they go to toilet once in 3 days. So this is mostly a subjective analysis. You can't do a test and understand like through a blood test if somebody is having a constipation. However, there is a test with the advent of small intestinal bacterial overgrowth. Just by doing a breath analyzing, there are some investigation centers which does a breath analyzing, and you can detect the small intestinal or bacterial overgrowth in your gut. There are also invasive tests, which is a gold standard, but there are much easier tests like analyzing your breath and to understand what are the chemicals, and accordingly we can identify to what level is the bacterial overgrowth. And this leads to too much gas and bloating. So that is a way to identify if your Vata is overboard. Now the problem with high Vata overboard, you cannot just change it by taking a pill. You have to change your lifestyle. You have to do grounding therapies, like you have to sleep on time. You have to fix your sleep as a priority. Whenever people say my Vata is high, they have difficulty sleeping or difficulty getting into deep sleep. That's why sleep monitors, like there are multiple gadgets that you can wear on the body, like a smart ring or a watch that can detect how deep is your sleep. This is a great way to understand how is your Vata. To understand if your sleep quality is very good, you're able to achieve deep sleep in a proper way, and you're waking up fresh in the morning, that means your Vata is quite balanced. So in order to sum up, good sleep, your resting heart rate, VO2 max and HRV both being in a good optimal stage, and then your vitamins to be balanced, your hormones like stress hormones, cortisol being balanced, and some of the tests like SIBO, small intestinal bacterial overgrowth test, and your overall, how do you feel? How is your energy levels? Do you feel restless? Do you feel relaxed? All of this is a way to identify if the Vata is overboard. In Ayurvedic textbooks, they mention some of the diseases which are dominant in each doshas. In kapha and pitta, they have like 20 diseases for kapha, 40 diseases for pitta. But when it comes to vata, there are about 80 diseases. And also, treating diseases of vata is way more challenging than treating diseases of kapha and pitta. Now, the reason is it's intangible in nature and it is amurtatva. You don't have a physical form for vata. And in modern medicine, you have a lot of diseases which are idiopathic in nature. We do not know what is the real cause. Now, all these conditions to a great extent falls under the concept of high vata. Now, for example, there are many studies which talks about how multiple sclerosis can be highly correlated with vitamin D deficiencies. Just by correcting the vitamin D, some of the symptoms of multiple sclerosis are coming down. So same way, if you look at it, some of the vata conditions there are deficiencies in the body. Now that needs to be corrected. So it comes out like, ancient days, we didn't have the ability to do the blood test or to do a heart rate variability or do an ECG to understand the heart rate. We understood the pulse rate. We understood to some extent the breath. By the way, when your vata is normal, your breath is also normal. Your vital capacity is very high. So when the vata is high, people talk about anxiety, restlessness, lethargy, fatigue. They have dryness in the body, dryness in the gut, bloating, constipation, or conditions like arthritis where there is too much of stiffness, and all the conditions where there is pain which is and we do not know what is the cause of this pain. And that is a condition where vata comes up. Now here, a lot of mental health, at the same time making sure whatever deficiencies are there, it needs to be corrected, and surrendering to the circadian rhythm, doing a lot of mindful activities, including spiritual work, pranayama, yoga, all these things put together, and spending time in nature. All of these are the ways you can recover from, your vata to bring it to a regulated stage.